to walk with us through a discussion on the US Census as it pertains to Middle Eastern and North African identity in the United States. It was in this very hall that I took one of my first classes at Harvard and was afflicted by sentiments of hope and the aspiration to change and be part of a change in the future. And I hope that after today's dialogue, you all find yourselves similarly impassioned to be part of that change. My name is Safa Salem, and I'll be one of the co-moderators for today's session.
And my name is Sarah Al-Zubi, and I will also be one of today's co-moderators for this session.
And it is with our great honor that we'll be introducing three of our distinguished speakers to all of you today. Before we do that, we'd like to introduce a bit about ourselves. And so this is my dear partner in crime and friend, Sada Al-Zorbi, who is a fourth-year MD MPP student at the Harvard Kennedy School and the Harvard Med School. Sada grew up in the Midwest, but is originally Jordanian. She attended Miami University in Ohio, where she was a Truman Scholar. She also spent time studying Arab Studies in the Sorbonne in Paris. And as the VP of Operations for Sona Global, a global orthopedics health organization, Sada was awarded the Martin Prince Award for Innovation in 2022 by the Harvard Medical School. She is also the former US Ambassador for Humanitarian Affairs to the United Nations, and she is very passionate about global health and equity, especially in the Middle East and North African region.
Woo! MashaAllah.
And I'm beyond honored to introduce my partner and friend, Safa Salem, who is a recent Harvard graduate with a concentration in history and science and a secondary in global health and health policy. Originally from Jerusalem, Palestine.
Yeah! Woo!
She is currently a second-year medical student and class president at the Ohio State University College of Medicine. She has presented her health policy research at national conferences and was invited by the White House to share her work last June. Presently, Safa is working on initiatives to introduce a separate and distinct category for Arab Americans on the 2030 census as a means to promote and empower our community. She hopes, and we hope, to continue to introduce and bolster efforts to advance healthcare as a fundamental right granted to all.
Now, without further ado, we know you all came today to hear from our distinguished speakers, so we're honored to be able to introduce our first speaker, Linda Sarsour. Linda is an award-winning racial justice activist, direction action strategist, community organizer, and mother of three. She is a Palestinian Muslim American born and raised in Brooklyn, New York. She was the co-chair of the historic Women's March on Washington, the largest single-day protest in American history, and co-founder of the first Muslim online organization platform, Empower Change. She is the author of We Are Not Here to Be Bystanders, a memoir of love and resistance, and we're in this together. Linda is one of the co-founders of Until Freedom and helps develop strategies and execute campaigns for the organization. Linda has been featured in local, national, and international media discussing issues of criminal justice, immigration, and immigrant rights, and U.S. foreign policy. Linda is most well known for her intersectional movement building work. It is my great honor to introduce Linda Sarsour. Our next distinguished speaker is Matthew Javid Stifler, a Lebanese American and the research and content manager at the Arab American National Museum in Dearborn, Michigan. Matt also co-founded the Center for Arab Narratives, a new national research program through Access, the largest Arab American community nonprofit in the country. Matt received his PhD in American culture from the University of Michigan in 2010, where he serves as a lecturer in Arab and Muslim American Studies. He is the former board member of the Arab American Studies Association and serves on the executive board of Michigan Humanities. He writes about food and identity. He is a passionate advocate for our community and has been one of the biggest and principal supporters of our organization, Afia.
Afia. Please welcome Matt.
And last, but certainly not least, Congresswoman Rashida Tlaib is a mother working for justice for all. She is a Detroit native of Palestinian heritage, a progressive leader, mother, daughter, friend, and community advocate. Born to immigrant parents, she built a career as a public interest attorney, challenging corporate abuses and protecting our civil rights. Rashida made history in 2008 by becoming the first Muslim woman to ever serve in the Michigan legislature, and then again in 2019, becoming one of the first two Muslim women to ever join Congress.
Yeah!
Congresswoman. As a Congresswoman, Rashida has fought relentlessly for the 12th District and vulnerable communities around the country, fighting against corporate greed, advocating for clean air and water, social equity, ending poverty, strengthening public education, and more. In 2022, she founded the House Get the Lead Out Caucus to fight to ensure that every lead pipe in America is replaced so that everyone has safe, clean drinking water. Rashida will not give up the fight until every person has an equitable opportunity to thrive. Thank you so much for coming, and please welcome our 3 guest speakers.
There are an estimated 4 million Middle East and North African residents living in the United States. The Arab community has long been fighting for representation in the US Census, since 1997 to be exact. Multiple organizations have worked on this effort in silos with little collaboration across sectors in a multi-generational way. We see this as ill-equipping us for health, political, economic, and educational challenges that our growing Arab community will face for years to come in the United States. We started the American Foundation for Improving Arabic Health, AFIA, to bring together key stakeholders to the table and to organize for a better reality when it comes to healthcare for Arab Americans. Our goal is to publish these healthcare data and use it to advocate for direct change in healthcare, along with more inclusion and representation of Arabs in med school residency, fellowship applications, but also the livelihood of our community. Our hope is to create a more targeted intervention that are better able to address the unique needs of our Arab community in tandem for advocacy and inclusion of the MENA category for the 2030 census. So let's get started. We'd like to first begin by allowing each of our speakers to take a few minutes to share a bit about their backgrounds as they pertain to the topic of our panel today, disaggregating Middle Eastern and North African Americans from the category of white in the US Census. Congresswoman, would you like to start us off?
Okay. I'm not sure you all know I'm the eldest of 14. And yes, mashallah.
Inshallah.
But now many of us are married, we have our own kids. I have some niece that's eligible to vote, as I tell folks, but we're more of a voting bloc at this point. For anyone to win any local school board, they probably have to go through my family. But what is important though is, even for them, just thinking about it personally, as an Arab American in our country, they are in many ways, their health disparities they're going through as women of color, many of my sisters and others, is invisible right now to our government. And for me, this, of course, is personal, but also for so long working at various nonprofit organizations, it was very incredibly hard to advocate on behalf of the people that we were serving. And so, as I represent Dearborn Heights, some of the Warrendale areas, these are communities that have influx of, Arab immigrants, but also folks that are coming from war-torn countries. Again, they are completely invisible right now. That's not just for them as adults, but their children, those that are now going through various educational struggles and challenges in school. And so it is important for many of us as we continue to talk about this, how important it is. I walk onto the House floor, I'm the only Palestinian American serving in Congress. Just alone that sometimes you feel unseen, unheard, and I'm a freaking Congresswoman. So I can't imagine what it feels like for that mother or that father or others that may have got cancer in their family and others have no idea that the federal government is not laser focused on that in our community in a way that I think could be impactful. And I'm so proud of you both doing this organization. And I mean, just even you talking about it, Linda said she got goosebumps. I was looking at you all, so inspired. It makes me want to fight harder for this to happen. So thank you.
Good afternoon, everybody. My main role at Access and the Center for Arab Narratives is to facilitate research to get better data on our community with the goal of improving the well-being of the Arab and MENA populations in the US. And as you all know, the data is pretty much non-existent. And so it makes facilitating important research on our community very difficult. And so I've been working for about 8 years with stakeholders across the country, people in government, community organizers and leaders, and researchers at all levels, undergrads, graduate student, faculty, to get better data and to create better ways to improve the services we offer to our community. Just as one example, I'm coming from Michigan, and Michigan has a very large and visible Arab population, but they're only visible when you see them on the streets. They're not visible in any of the data. We know that there's issues in our community, specific health issues and mental health needs, and it's really difficult to advocate and to get people to see that the community has these specific issues. What we do know from the data that exists is we don't know enough. That's really the number one thing we know. We know we don't know enough. And so if we all pull together, and we're at a point now in the history of counting our community, we're at a point we've never been at before. People have been working on this for 30, 40 years to get a box for Arab and MENA communities, and we've never gotten this close before. And so it's really important that we rally together and push it through the finish line. And it's going to be a game changer for the way we see ourselves and the way that the rest of the country sees us and takes account of who we are. So very happy to be here, and thank you for coming.
Marhaba, assalamu alaikum, everyone. I'm very honored to just be on this panel, and it brings back a lot of good memories. I kind of wish I was on the panel before this one because it's spicy. I like spicy stuff. But this is important what I'm on. But that other one, that was good. I want to just say this about this work around adding a MENA category and Arab category to the census, that for me it's not just about representation. I don't give a damn about anybody. We are here, Arab are here, we as people from the North Africa are here, we are here. So we just want to be clear about that. It's not about that I care whether the government knows I'm here or not, because we are going to be here, we are going to be all of us. The MENA category is beyond this idea of recognition, right? Of just deciding that we are here or not. It actually is about opportunities that we do not have because we do not have a MENA or Arab category. We are Arab, we are entrepreneurials. Allah created us like that. And we are probably, if we went around the country and actually looked at how many businesses, how many small corporations, major corporations are owned by people of Arab descent, the lists would be endless. I will tell you that. Many of us whose parents are small business owners across the country. So because we don't have a category, we don't have a designation, for example, under the minority-owned business category. Mm-hmm. We don't qualify for small business loans. Our children don't always qualify for major scholarships to go to major universities in the United States of America. Mm-hmm. So for me, I don't want people to think that this is like, oh, we're such a weak community, we're demanding that the United States government recognize who we are. I don't care about that. I care about us getting equal access just like other communities who are marginalized in these United States of America. When I think back to my work, and I want to give a shout out to a woman who's not in the space where I learned about a lot of the census work, from a woman named Helen Samhan, who's from the Arab American Institute, or used to be at the Arab American Institute at that time. And I came in later, I was a young organizer, and in 2009, it was the year before the 2010 census. And the census was going around the country. They were saying, we need you to do outreach in your community, do outreach. I was running a nonprofit organization anyway. So they were like, we're gonna give you money to do events and stuff or whatever. And I said, so I could do whatever I want? However, I know how to outreach. They said, whatever you do with your people, you know your people, you do your people. I said, okay. So a couple of us across the country from New York to California started a campaign called Check It Right, You Ain't White. And that was our campaign. And listen, I had a flyer. This is going in the history books. It's
yes,
in our
it is. It's on the
and we
internet.
actually gave instructions. We said, check it right. We didn't tell you what to check. We said, check it right, you ain't white. So just make sure that when you get to say you're not white. So that only gave you one other category, which was other. And then we told you, right Yemeni, right Egyptian, right Palestinian, right Arab, right Moroccan, right whatever it is that you want. But just don't check the white box. Mm-hmm. And in fact, the US Census came back to us and said, why in the hell did you do that? Because now you just made more work for us, because now everybody that checked other eventually somehow ends up back somewhere in the white box anyway. But the point is, it made more work for the US Census. And you know, anytime you make the government do more work, that's me, call me up, I want the government to do it. But the point is, it was something that was very empowering to our community to start hearing for the first time why it was important for us to be represented on the US Census. And as Matt said, we are now closer than we've ever been before, and we need everybody on board to advocate for the MENA and Arab category.
Thank you for those very impassioned responses. You guys really did touch up on a lot of the questions we had, but I guess we'll use our questions as a guiding point to dive a little deeper. Our first question is that the premise of adding this sort of Middle Eastern, North African box in the US Census has really been, as you mentioned, a political campaign for decades. I have a question for each of you on this particular topic, and so I'll ask them one by one. Beginning with you, Congresswoman Tlaib. As one of the first major representatives of Middle Eastern and North African descent really working within Congress, how have you approached this topic from within the US government?
You know, so many of you might not know, but I was on the House Oversight Committee, and that oversaw the US Census. And at that time, it was the cycle for the census to go out. And there were so many oversight hearings, specifically on the decline of regional offices, hiring up early, not just only obviously counting you know, everyone, but also the most hardest hit communities, especially Black and brown communities, indigenous communities, that always continue to be undercounted or uncounted through the US Census Bureau. So as opportunities came and the director of the US Census came, of course, many of my folks asked really great questions about that specific question around how do we get to the hardest communities to count. And so I used that opportunity to ask the director of the Bureau if he thought I was white. And it was a very powerful hearing. Many of you saw it, and then of course you only see the exterior, but what you need to know is after that hearing, the chair of the committee said she'd like to talk to me. And she said, I did not know this. It was a very eye-opening moment, a aha moment, I think, for her. And so the chair of the House Oversight Committee, Chairwoman Maloney, and I worked on a letter together to the Office of Budget and Management, where we began the conversations that led to the point that we are here. Again, it took courage for me to ask that question, but also I wanted to make it impactful for people to understand what it felt like for me personally. I think my staff was looking at me funny when I said, hi Layla, when I said we really, you know, need to use this opportunity to ask this question around MENA. And it was, again, if you ever look back, it was very hard for him to answer that question. You know, you could pick other. He began to kind of fumble a little bit. But I think at the end, many of my colleagues, both sides of the aisle, were very much like, wow, had no idea. And so again, for me, again, using the fact of mere presence being there and bringing that into the room. And I was very lucky. I mean, I worked with Access afterwards in helping draft this letter for their guidance and advice on specifics, especially on challenges in serving the community. And again, this has actually grown a very strong relationship with the person that runs the budget office about actually moving with more urgency on this issue. Yeah.
Thank you.
Thank you for walking us through that process. I think one of the other big questions we have, it sounds like you've done a lot of work with Access and NAC, and Matt here is, we know, one of the biggest representatives and organizers with them. So Matt, we wanted to know what that process looked like from your perspective.
Sure, and I have to say I teach Introduction to Arab American Studies, and every term I use a picture of you saying, do I look white? And that's the basis for the discussion around the census and the representation, because it really gets people thinking, like you said, and it has led to change. And Linda, I'm so glad you mentioned Helen Samhan and the Arab American Institute, because in the 80s, they were having these conversations trying to get our community to say, we need our own box. We need a way to recognize, because we know that the community has always been treated as a marginalized community and discriminated against, but there was no way to track that. And so for almost 40 years, we've been fighting for this. And so we need to recognize it's not a new issue, but like we said, it's new in the fact that we've got the national attention on us. So we really need to make this work. But yeah, I come to this as a researcher who knows that the data that is out there, it's not a lot, but we know things like when you take, right now Arabs and other Middle Easterners for the most part are under the white category, and when you take Arabs out of the white category and just look at the Arab data, you see that they are very different than the white population. We're almost 3 times as likely to live in poverty than the white population. There's this weird paradox around education where the Arab community is more likely to have a college degree than the rest of the white population, but almost twice as likely to not even have a high school degree than the white population. So what's going on there? Well, we don't know, because it's just one data point, and we really don't know what to do with that, because we need more information and we need to look into this. I work for a human services agency that is really active in substance use disorders and addressing the opioid epidemic. And where a lot of Arab communities like to think that it's not happening in their community, it is happening in their community. And in Michigan, it's really bad in the Arab community, and we know it, and we're addressing it. But when you go to the state data and you say, how many Arabs do you have in your overdose data? They say 0. And we're working on that right now. We're working on ways to get us in the data, because you can't fight, you can't produce the services you need to address the issue if it's not even there. And so it's really important, and I'm more than honored to be up here with 2 folks that have been doing this for a long time and are very passionate about helping the community.
We're so happy you're not intimidated.
I'm hiding it very well. I'm very, very put together right now.
I think we're a little intimidated. Yeah, I think that Matt brings up a really great perspective on the topic of research and why data is really important for our communities. Data allows us to gain access to things like civil rights and services, funding, targeted interventions that can supplement the issues that our communities experience. And so data is not something to be taken lightly. We know that, Linda, you've been working really from this activist perspective since you first began your career in the early 2000s. And the topic of Arab identity and the US government collecting data on us has always been around. Can you tell us what that looks like from the activist perspective and a little bit more about your early career?
I think this is an important topic, not just looking at it from the perspective of putting a category on the census, but really deciding who we are as an Arab American community, as a North African community in this country. The bottom line is we, like many minorities who came to this country, and some who were able to do it much easier than us, like Italians, Irish, and others, people came to America with the understanding that the closer you are to whiteness, the more access you will have. But what our Arab community learned the hard way is that we are one of those communities that did not necessarily work for us. Now, it worked for some people. It did work for some people. For some of the early Arabs who came here, right, that came here over 100 years ago, some of whom were from the Levant, some of them were Christians. They were able to kind of be part of a dominant religion here in this country. And some of them, some, not all, because some of them are also still, they're all our people, so even some of them struggled, right, to be able to really integrate into the society. And so for me as an activist and an organizer in a country fighting for racial justice, right, fighting for economic justice, immigration and immigrant rights, and fighting for refugees, we also had to struggle as activists and organizers to talk to Black folks and talk to folks from Central and South America and folks from the African continent to be like, listen, we with you. We're with you. Now, yes, the census says, and everybody else thinks, and there's some of us in this room, by the way, who are white passing. Right? There are some of us, especially for some of us, like if I wasn't wearing hijab, right? Some of us in this room can. Let me tell you, some of you, no matter what you do, it's not going to work. It's just not gonna work. My North African, Yemeni sisters and brothers, Egyptian, it's not going to work. It's not gonna work. And so being part of an activist movement to also educate sisters and brothers and family in our activist movement about fighting for justice to ensure that we are included in that fight for justice. This government has proven over and over again to you that you are not white. From endless wars against our people, from unjust foreign policy, to national security reform policies that have targeted our people, that have detained our people, that have incarcerated our people, the closing down of humanitarian organizations run by Arab Americans who are supporting our people back home. The lists are endless, folks. Deportations, a special call-in registration program after 9/11. I could sit here for 10 days and tell you all the things that this government has done over and over again to prove to you that you are not white. Because if you were white, none of those things would happen to us. And so that is why it's important for us to finally get our own category, to have our allies also fight for us to get our own category. Because whether we like it or not, this country has racialized us as Arab, and they have also racialized us as Muslims, right? Yeah. And guess what? The ignorance in this country also says that we're all the same. Arabs are Muslims and Muslims are Arab. So we have to get to a point where we start disaggregating ourselves from the ignorance of this country and making sure people know who we really are. And that we are Arab, are Muslims, we're Christians, we're Druze, we're Jews, we're all kind of people. And it is important for us to be leading on that work. And I think we, again, as we said earlier, are closer than we have ever been before, but we need everybody on board to make it happen.
I love that. I think the intersectionality and the allyship, I don't think you can do it with, I don't think you can do grassroots movements. I don't think you can do activism without allyship and intersectionality. And I think you touched on a really excellent point of like, we have to look to other communities. We have to build that backbone. And I think Congresswoman, you know, you mentioned you nearly like 8 months ago, you wrote a bill with Carolyn Maloney, Rep. Carolyn Maloney from Astoria. And so, you know, kind of thinking about it even from a political perspective, what does that look like? Getting folks in Congress that aren't Arab, and perhaps, like you said, with the, you know, the Census Director Dillingham, when you were trying to explain it to them, and a lot of people were like, "What are you talking about? We didn't even know this existed." How do you do that within a political realm? Like, how do you get people on board to kind of see that allyship within a political sphere?
Yeah, you know, I always love to remind everyone, I was born and raised in Detroit, in the most beautiful, blackest city in the country. And one thing that I've learned growing up there is that transformative, meaningful change doesn't happen with who's in Congress or who's in the White House, but it truly happens with movement work outside of those places, pushing in. And why that's important is that you all don't realize many of the organizations, many of the folks that are, again, all across the country that have been fighting for this are talking to their members now and asking and demanding that they support a move towards having MENA recognized within the federal government as well as the census. Again, this is really driving from within to make those administrative changes now. And so one of the key things is I love when a colleague can come up to me and say, I met with so-and-so human services organization working with the refugee population, came to me and said, you're working on this issue, can you tell me more? That's how we are able to bring folks together. You all don't realize the credibility you give to someone like myself and others who are pushing from the inside is when you are speaking out about it. And again, this is one of those easy asks. It really is. I want our federal government to see me and hear me. You know, the other asks are tougher, as you all know. And so this is one of those conversations, again, that continues to expand because of that. And it is about also, you know, understanding the intersectionality, but many of the public health organizations, folks working on the opioid crisis, all of those are wanting that data too, not just our own community. They truly do. Because they're not like based on specific communities, they're based on geographic service areas, if you know what I mean. So we're talking about areas and communities in the Midwest, in the middle of our country that, again, don't have, you know, concentrations of Arab, but they are serving communities, vulnerable communities, and they want that data as well. So just know that that is also coming in. So when I'm putting this letter forward or talking to colleagues, it's because folks from the outside are talking to them.
That's right.
And I guess one of the follow-ups to that too is I think a lot of it too, you know, I think a lot of it is that intersectionality is really important. And, you know, asking and bringing it up is part of this discussion and why we wanted to have a panel on this. Because I think a lot of us just assume it's less important, but it's those opportunities that Linda's talking about and that Matt is talking about. And I think when a lot of people, you know, talk about data and health, they bring up Dearborn, right? It's like, well, like 40,000 Arabs live in Dearborn out of the 4 million, right? And so, you know, you can't just focus, right?
It's a lot more.
Is it really? Oh, no, Matt's going to correct.
No.
Is it 70,000?
Probably.
Yeah.
70,000 out of 4 million, right? And so everyone's like, oh, well, there's data coming out of, you know, Michigan. And it's like, well, what about the rest of the 3 million plus that are not being counted and are not being accounted for in healthcare, education, and all those other places, it's not just a Michigan problem. This is a problem across the country, and I think that's exactly kind of what you're highlighting on. I think, Matt, you've mentioned work with like the Pacific Islanders and Asian Americans and kind of that fight too, like how you've brought that into the conversation. What does that look like from your end?
I just want to go back to disaggregating from the
I'm West
ignorance.
Asian.
Can we go back to disaggregating from the ignorance? Because that was like, you want to talk about a mean line? That's a good one.
That's a good one.
West Asian, yes.
He looked at me and goes, that was good. That was really good.
If I use it, I'll attribute to
I
you.
try.
I'm just
Yes,
saying.
please.
No, but I mean, the goal is a MENA box, right? But the goal is the ability for everybody in the country to identify in ways that are meaningful to them. You know, the boxes we all check on all of the forms, they haven't changed in 26 years. They've been the same for 26 years, 1997. Think of the way in our country we understand racial identity, talk about racial identity, experience race differently than 26 years ago. So while we're fighting for a MENA box, we're also fighting that all these other groups that have been marginalized have a way to express themselves that is meaningful for them. And so if you talk to the Native Hawaiian and Pacific Islander community or the Alaska Native and American Indian community, they don't show up anywhere. And they're extremely marginalized. And so we're making sure that they're on the form in the way that makes sense for their community, in addition to adding a MENA box. So it's really important that we don't just put blinders on and say, we only care about MENA. We care about making sure all communities have a chance to express themselves in the way that allows them to then do the services that work for them and to show up in the ways that are meaningful as individuals and as communities. So always be thinking about that.
I think that you really touch up on this point of 26 years is a long time, and the demographic composition of our nation has certainly changed, especially when we look at the influx of refugees from crises like the Afghanistan war, the Iraq war, or Syria or Palestine. And so tying back to a point that you made earlier about how you made a comment to the census director, I think it's Dillingham, back in 2020 about, do I look white to you? And this idea of just writing us in, why is it so important for our community to actually have that formal box as opposed to writing us in? Why is the actual ability to identify truly as our community, to disaggregate us from these other identifiers, crucial to enhancing our rights within this nation?
I mean, I think you all hear about the political representation, and I'll have Linda actually talk about that. But again, I come from human services, or I'm a social worker at heart. And when we're on the ground trying to fight for, if it's food insecurity, especially among some of our newly arrived immigrant communities, especially in the school system, any of that, public health data, we constantly hear about that. Even, and I know others have always touched around civil rights, they always go straight to that. But I promise you, many of the people walking in through the door of various nonprofit organizations and others are dealing with other struggles. Like, we're seeing a huge rise and a hike of diabetes among many of our Arab Americans in the United States. You're all nodding your head because you know somebody that has. We are not being laser focused and getting the resources. It's not just the funding, it's also the research. It's also just the building the capacity out to do the kind of outreach that's needed to teach folks around nutrition, or maybe it's around access to insulin. Whatever it is, it impacts the daily lives of many of our residents. But right now we are being lumped up into a category and it's almost like we're just buried in this data category of white, and we're like invisible. We literally are invisible. It's not making any impact because it's not laser focused and understanding. It also is important, again, when we had people walk through these doors and various nonprofit, organizations I worked at LaSed, International Institute, other places. What I saw even at LaSed is we had, it's a Latino-led community, is we had data that showed 30% of the folks within the Detroit public school system were Latino. And do you know that ventured into us being able to hire up more to have wraparound services for that Latino community? And I say this all to you because right now that is not happening in our community. Sure, we have some organizations that have been very successful in working with private institutions like universities, academics, getting us that data. I see them doing that work, but we can't allow that to continue without the kind of federal, I think, partnership that's needed. We spend billions billions of dollars every year in the United States federal government on public health research, billions. We spend so much money on public health, on integration, like programs, a number of things. And right now, we are completely unseen right now in all the data, all the information that's coming through. Again, for me, as we fight for these various policies, when I say our community, when I say, hey, look, my Arab American mothers are seeing a hike in prenatal births, I can't say that right now because I don't think we're even monitoring that in a way that could be powerful. I can't go back to colleagues within the appropriations process and say, this is a problem, we need to address it, because I don't have that information. I can get anecdotes. I can go and say Wayne State University did a study, but it's not as powerful when I say the public health department is saying this is an issue within our community. And so I think it's really critically important that I want to be able to grab that census data or whatever it is, and I love it, and I can see, okay, I have my Black community here is struggling with this, my Latino community is struggling, Asian community, and I have no category for the majority of my Arab American residents to be able to fight for them to get, again, those resources to build that capacity. It is so incredibly hard to even be able to explain it to our community. So everyone in here, I hope you're looking to submit comments before the April 12th deadline. You all can be able to speak up for many of my families that might not be able to even know to go online and do that. I mean, I wish we had public hearings because we're a community that likes to talk. And no, really, put some microphone. I've said that 100 times I always request public hearings because we want to be able to submit our comments orally, instead of this whole thing, go out here, click this link and submit your comments. And I know folks are working to make it as easy as possible, but that is another barrier that we probably could get data points showing, literacy, access to broadband internet, any of that. I don't have any of that data to go back to my folks and say, we deserve a public hearing because this and that. And again, I've been able to do that in my Black communities as well as my Latino communities. My Black and Latino neighbors always know where she is going to pounce up, and I'm like, listen, my community, only 20% right now have access to cable. So I don't know how you're communicating to them, but that's not working because 80% of them are not having access. This is how I can advocate the best possible way. But as a United States House member right now, representing such a large population of Arab Americans right now, I don't have the luxury of that information, and it really makes it incredibly difficult for myself and so many others. Again, I'm not trying to, this is not very, it's kind of simplified, but when I tell you we have breast cancer, diabetes, prenatal births, all this stuff, I know it has to do with many of the folks where they're coming from, what they've been exposed to. I'm not, I'm not that doctor, scientist, that health researcher. I need our government to be able to step up and do that research so that, again, I can go advocate for them to get access to those resources. If it's health coverage, if it's more direct funding for culturally sensitive programming, we're not going to be able to change people's lives for the better if we don't have that information.
That's right. Yeah.
Can I just add?
Yeah.
So Congressman Tlaib said this earlier. She said it's an easy ask. And our community, we have a lot of asks, and some of them are not that easy. I think they're actually all easy. It just depends on the will of who the people in power are, whether they want to fulfill those asks or not. The question is, why haven't they done it? That's the question we need to answer today. What's the problem? Go on your little Google form or whatever you use and add a box. Like, what's the problem? It's actually quite simple.
I don't think they use Google.
Yeah. I think Google Forms might be even more sophisticated. But anyway, add a box. What's the problem? Let's ask ourselves, what's the problem? Why don't you want to do this? Why have people been asking for this for 40 years? Why have there been so many people that have taken this on as literally their life's work to add this category? And there are people that have not wanted it to happen. Because we allow for this government to say that we are a white majority nation. That's it. We maintain the white majority of this country. So if they said one day, and inshallah they will because we're going to fight for it, took all of us out of the white box, right? What that's going to do is significantly decrease the white population in the United States of America. And that doesn't go well for the white supremacists in this country. It doesn't go well for them. So they're gonna, even by the way, when I say white supremacists, a lot of people have a particular thing in their mind that you think I'm talking about, like the MAGA guys. Trust me, even the ones you think are with us ain't with us, right? They are imagining how the shift in the demographics of this country is gonna be and what that's going to mean for political power and political representation in this country. The more of our young people that get more access to scholarships to major universities, whether we qualify under things like affirmative action, whether or not our small business owners are even giving more resources and investments to build even more wealth in this country, trust me, this is systematic in its way. And the reason why I know, and the government should do their job, and I know they know how to do their job, is because they create lists and they track us on our race and on our ethnicity and nationality and religion all the time. So after 9/11, you built policies that were specifically targeting Muslims and Arab Americans across the country as an immigrant, so you know how to do that. After 9/11, you created the Department of Homeland Security and the Special Call-in Registration Program, and you figured out how to identify 25 Arab and Muslim majority countries that you put on the list. So when you want to do the job and you want to study us, when you want to surveil our mosques, when you want to surveil our organizations and our political activity, mashallah, you know how to do that. So if you could do all of that, when you want to know about us, then at least, let me be able to claim a good kind of discrimination, because at least I have a category on the thing. My point is that the people that have been blocking this for so long, they know what they're doing. And we just got to be smarter than them, right? We got to understand what it is. And that's why it's so important when you see people like me and others in our movement, when we're organizing with black folks around the country, with Latinos around the country, with Asian American Pacific Islanders around the country. This is not just because, we, of course, care about them and their communities and their issues. It's about building power across communities because we're all being impacted the same way. We're just a little later on in the game, right? And so we're just trying to catch up with other folks that already had affirmative action fights, that already had fights about adding categories. None of the people that got categories right now is just magically happened. Everybody had to fight for it. And for us as an Arab American community, and we're just such a diverse community, it's hard to get all our people together. We can't agree on Syria, we can't agree on Yemen. I mean, we're just a hot mess, just so we all know. We got a lot of work to do. But this is one issue, the one issue that I could imagine that we can actually bring our people together around, right? Put the politics aside, put the political ideologies aside. This is the issue that I think we could bring the Arab from across the region, people that are of different faiths, of no faith. This is the issue that I think we could really prove our influence and power in this country. And I'm telling you, it is something that we need.
Mm-hmm. And just very quickly, our diversity was used against us in 2000 and 2010 by the Census and the Office of Management and Budget, which controls the way race and ethnicity is collected. They said, no, you can't have a box because you guys can't agree on what you are. Like, are you Arab, are you MENA, are you this, are you that? And so they used it against us and said, well, we did some polling and everybody was saying all these different things, so, khalas, no box because you can't decide. So now we're at the point where it's like, we know who we are. Count all of us no matter what we say, right? You can call yourself whatever you want to be as long as we're counted. And so now we're at the point that they can't hide from that anymore. So, yeah.
Yeah, thank you guys so much for elaborating on this topic of why the box is so crucial. I think Sada and I met in the fall and we really talked about why, from a healthcare perspective, it's so important to be able to collect data on our communities. And I know that Congresswoman Lev, you mentioned a lot of things like prenatal care, even diabetes rates, and these are things that we're looking into. Sada and I started the first national study on Arab American health this past fall, and one of the things we're doing is aggregating by language. Woo! Arabic to really take a look at the disparities that our communities experience. And so in our database, we already have 250,000 patients who identify with Arabic as their primary language spoken at home. And so be able to collect that sort of information is crucial. I'm a cancer survivor, very personal, but I'm a stage 4 cancer survivor. Thank you. And so one of the things that I was really afflicted by growing up was this idea of stigma in the Arab community. You know, my family heard cancer and they thought death sentence, like you're gonna die, you're not gonna make it through, and stage 4 is metastatic, and so we don't really see great rates with that. So one of the questions I looked into for this was, of the Arab community, when we get diagnosed with cancer, how often is it advanced? Because we're too scared to go to the hospital, and people don't know to screen our communities, and we don't even know how our communities exist when it comes to cancer. And so, I think our big question here is, Matt, you've been really involved in this idea of research. Can you tell us so far the work that has been done on trying to even collect data and how difficult it can be without this formal box?
I mean, so yeah, they have access to a database with 250,000 folks from our community, which is the most that's ever been accessed. But even to get that, the amount of hoops that they had to go through, right? It's just not readily available. Researchers come to us all the time in Dearborn and say, can you get us, we want to survey 100 Arab Americans about cancer screening, and that's the best data that's going to be available. And so it's really difficult because we're working on such a small level. And like the Congresswoman said, you can't go to the federal departments or even the state departments and say, here's 100 survey results that show that there's a problem. They're going to say that's cute, and that's really cute, but that's not going to help us change policy or change action. So we really need those major data sets. That's the only way it's going to work. The little stuff is great, right? You can do 50 people, 100 people, 500 people in a survey. Those are enrolling all the time. And when you see those come up, please click on those links that say, please take this survey about Arab American health, because that's the only way we're getting data right now. And so what they're doing is very important, and the federal level is important, but it really takes all the individual people who are willing to self-identify and to participate in these things. So yeah, keep an eye out for all those studies that are out there.
Yeah, and you know, to tie kind of back to AFIA and the Health Inclusion Act that you wrote with Rep. Dingle, I think a lot of what we're looking at with our initial studies at AFIA is we have, is it on? No, it's off. Wow.
This is better? Oh yeah, that's much better. You know, kind of tying it back into the Health Inclusion Act that you wrote with Rep. Dingle of Michigan, and thinking about what this means for our Arab community. Looking at our initial studies at AFIA, what we're seeing is we have found that we have worse and severe mental health illnesses. When they are found, they tend to have worse outcomes when it comes to remission. Diabetes, I mean, we still talk about insulin. We are way past insulin from a medical perspective. There are way better medications from a medical perspective that our community deserves.
That's right.
And that needs to be brought up at the front line. You know, insulin is the big topic. We are past that in medicine. We need to talk about these bigger meds that our community should have access to, that have multiple effects that are beneficial at, you know, at multiple levels. You know, Safa here talked about the prevalence of metastatic cancer. When we do find cancer in our community, we're finding it at a much later stage. What we're seeing is we're not screening, colonoscopies, mammographies. Like, our community is just very well served. And you know, I think the issue is we don't have the public health data. We don't have people that are paying attention to what our community needs. And I think the pandemic was another big hit where we saw, like, the Arab community does not respond like the white community. And I know Matt and I were discussing this the other day, but you can't just shut down Dearborn, you know, during a pandemic. There's more, it needs a more complex, and it needs more studies. It needs to understand, like, we are a community. We function as communities. We don't function as individuals. We are centered around families, and that's how we work. Like, we need to rethink about how we do healthcare with Arab community, and we do it in a culturally sensitive way that actually understands our communities, that allows us to have literacy and interpreters in a way that is not stigmatized, in a way that actually welcomes questions, and in a way that allows us to actually have better healthcare outcomes. You know, our goal is not to just, you know, study this. Our goal is to actually have better healthcare outcomes in the long run, in healthcare and outside of healthcare, because at the end of the day, healthcare is not just the medicine or the prescription you get. It's the education that you have at home. It's the safety of housing, food security. I mean, social work is the foundation of a healthcare system, and so I think this is exactly what we're talking about when we're discussing AFIA. Mm-hmm.
Before we shift over to the audience, because we do want to give you guys adequate time to ask questions, I think members of our audience, and Sada and I are included, can often feel powerless in these sorts of conversations. It can feel very difficult when you're part of a community that has been erased for so long to try to make this pave way forward. And so I guess as people who have been so involved in the work so far, how can our audience really get involved in this topic and make that push that, Linda, you were talking about, uniting ourselves under this front of getting our recognition? And I know, Matt, you've been working a lot with NAC to get this up and running, and we'll have a slide for you guys to see in a second, but really, could each of you just tell us what you think as members of our community and advocates, each and every single one of us, what we could be doing to kind of make this push even stronger?
You know, I'm going to get into the office on Monday. I'm going to ask how many comments were submitted. Because if you all don't want to be invisible, then show them that you exist and that you're here. And by doing that, by submitting comments, you're going to show. I don't want to hear 2,000, right? I know you guys got 2,000 submitted so far. We can do a lot better than that. And so this is our opportunity. Again, this is the closest we can do. By the way, there are at least 5, 10 people. I know you get told this, but you are usually, if you're in this room, this is something important to you, but you are probably the person in your family that if you texted everyone in the family, they would do what you tell them. I mean, no, really. I mean, there might be some debates, because I am literally, I create a slate for election day. I'm the one that everybody calls, which judge, Rashida, do I vote for? But you probably are that one person. And again, help your family member, get your friends, get folks. There are too many people that I'm running into have no idea this rulemaking is open right now. There's so many people have no clue that this is open. They're like, what are you talking about? The census is over. I'm like, no, this is, really, it is very mind-boggling, because again, many of the organizations and folks that have been fighting on the ground, they don't have the kind of capacity that is needed to kind of do this big, we really don't, of getting it to everyone. I've been traveling, doing all this work, and I'm still shocked at how many folks are like, what's MENA? And so I think all of you, especially, I mean, can you imagine, I think all of you in this room could probably get thousands more of comments submitted. It's so critically important, because everything that we're doing right now and fighting for this for so long, this is our opportunity, and again, this is the closest we've ever come.
Yeah.
If we can go to the slides, if you can go to the slides, I'll put up.
He's going to put a slide up. Yeah.
Before we transition.
Yeah, I'm gonna show.
Put the slide up while we're talking that way.
Perfect.
Okay, so if you go to bit.ly/support MENA, and MENA has to be all caps. This is the National Network of Arab American Communities. It's more than 25 community-based Arab orgs across the country. This will take you to a place where it'll teach you how to submit comments, give you some ideas of what you can say. And like the Congresswoman is saying, we have to do this, because last time they said, well, not enough of you care about this, so why would we add a box? We have to show them that we care. We don't know how I have to agree either. It's not about you have to all say the same thing. They just want to know that we care enough to think about it.
in the Black community have the same challenges. So don't let that strike you. But this is your time to at least, let's get on this. Let's get into the federal government, get our box. I don't like calling it box because it's more than that. But it really is.
Well, it's not, and also it's not just the census. This is the Office of Management and Budget.
Yes.
They control the federal race and ethnicity standards for every agency,
Every
the whole way down. So every local health department that asks race and ethnicity does it according to the federal guidelines. So getting it through the OMB not only adds it on the census, but it's a game changer for schools, hospital systems, state health departments, everything. So it's very, very important. It's much more than just the census.
So I'm an organizer, and I'm going to tell you the same thing. The link is up there. You're going to make it a link, because obviously it's not, on your phone. And you're literally, everybody here can get 10 people to do it. So let's just say, and hopefully the organizers could then send it out to all the registrants that have been at the conference at different levels this weekend, and just say, hey, can 10 of you do it? Everybody, some of you, as Rashida said earlier, some of us come from a family of 10. So we could literally do it just within our immediate family. And I think the thing that I will also say to people, that not only is it like an organizing, practical thing that you could do, it's also about how you show up in the world. I got a lot of, listen, my parents named me Linda, and I regret the day that they decided that was the name that they gave me. And I understand, I was actually named after an Arabic song that came out in 1980, if you all remember that song. So it was an Arabic song, but it was called Linda. But anyway, a lot of times, even how we show up as Arab Americans is not in our whole selves wherever we are. Like everywhere I go, you are gonna know I'm Palestinian American, whether you like to know or you don't like to know. You know, if you are Egyptian, I wanna know that you're Egyptian. If you are Moroccan, Algerian, if you are Jordanian, if you are Yemeni, wherever you are from, you gotta show up in your whole self. Because that's the thing about what this country, the marginalizing of us and the erasing of us is for us to be almost apologetic about who we are. You gotta be unapologetic. You gotta put your back straight. You're at Harvard University. Everybody better know that you are an Arab American at Harvard University. And this is why a conference like this one of high caliber at a university of this prestige to know that this idea of identity is very important to who we are. It is why we are who we are. It is why you are where you are. It is part of why you are at Harvard. That this idea of our stories and where we come from and the sacrifices of our parents and our grandparents for us to even be and sit in spaces like this, for Rashida to be a congresswoman right now. And so while it's definitely something around, yes, building a MENA category, yes, advocating for justice for our community, but it's also about you being unapologetic about who you are. In a lot of spaces, you know, there's people, your parents tell you, don't get involved in Arab Student Union. SJP
Linda,
situation.
my mom goes, شو بتسوي؟ ليش رايحة على I said, Mom, I'm a congresswoman. She goes, no, literally, she doesn't want me to go get arrested for.
Like our parents, and they do
it
that.
Won't stop.
And they do that, by the way, of course, out of concern for us. Like, it's not that our parents don't love us; they're concerned for
they're
us.
very
But at some point, somebody got to get up and say, I'm going to organize on my college campus as an Arab American. I'm going to organize for Palestinian rights. I'm going to organize around just U.S. foreign policy when it comes to the Arab world. And that's who we got to be, because that's also what the government doesn't see from us, right? We are trying to, a lot of us are trying to mix in. I don't like to mix in. I like to be extra, extra wherever I go. So that's what I need. That's part of, after you text the 10 people and tell them to do the comment, then after that, everywhere you go, you're just gonna make random conversation and just tell everybody, like, just hi, how you doing? I'm Palestinian, by the way. Where are you from?
This is a great time to switch us to questions. There's going to be a lot of questions, so we're going to set some very strict rules, and we're going to stick to them. Otherwise, somebody will come take the mic away from you. It must be a question with a question mark at the end. You all know English grammar. And there needs to be no commentary before. So ask the question with a question mark at the end and no commentary. We're going to take multiple questions at a time, and then we'll pause and do answers, and then we will do another session, and then we'll move from there. Okay? All right. Do we pick?
Yeah, I guess.
Oh, no.
we'll just try to make our way around the room. We'll take one from each section. So you, and then you. Yeah.
Oh, sure. Sosan Samara, living in New York. I guess I'll start with, my question is simple, actually. Why MENA? Why not Arab? Why not WANA, Western Asia and North America? We are not the Middle East. Like, I know this is what we're called, but I'm sick of people calling me stuff I don't agree with.
Great question.
Great question.
Who is the person in the middle?
This is what we chose. It came from the community.
All right, Layla Mukhaber from Washington, D.C. Love and adore and respect each one of you on the panel. This was so moving. I already took action and sent to 6 group chats on WhatsApp.
Ooh. Oh, the WhatsApp.
It was pre-filled, so if you didn't do it yet, get on it, send this to all of your family, and urge them that you're challenging yourself to do 10. Another question, it's just specifically for the Congresswoman. How do we keep you in office? Where do we donate? I have to ask while we're all here, because everyone here could be doing that. Maybe somebody else from the panel can answer that question. Thank you, Linda.
So are we going to do all more?
We'll do one more question.
This is why my chief of staff has to run my town hall.
Thank you for having me. Abdurrahman Khalil, I'm master student here at Harvard Med School. My question is, like you mentioned earlier, that like surveillance state against Arab and Muslims here. I mean, it might be a naive question, but like, can we have, like, for example, some kind of access to this surveillance data from the government? Might help us to through like this statistic, like population for the MENA region. Thank you.
Thank you.
That's a good question.
That's a great question.
Okay, so you guys can take those in any order you
Yeah,
like.
I guess.
You want to do the MENA
one?
one?
Yeah, that's a fantastic question. Why MENA? It's not a perfect category. You know, the term Middle East is a colonialist term, but so is the term Asian and Asia. So like, there's no good term. It's SWANA, AWANA, MENA. No matter what, it leaves somebody out. It makes somebody feel uncomfortable, and yeah, so it's tough. I say like, you know, Arab and MENA, so it gives people options to identify. The problem is it's not a good category. It's the best we have. And the reason that we're pushing MENA is because it's been in the conversation so long that if you went to OMB right now and said, oh, we're going to switch from MENA to SWANA, they would be like, okay, this is what we're saying. If y'all don't have your ducks in a row, why would we do this at all? So yes, I'm not saying just grin and bear it and identify in a way that you feel is colonialist or orientalist. I'm saying that if we want collective action, this is the best we got, and we'll start here, and then next census,
And
we'll
so-
change it to something that
And
makes more
Selson,
sense.
I want you to know, like, doesn't take away from us. We don't call ourselves. Like, my Latinos don't call themselves Hispanics.
That's right.
You know what I mean? So, no, really, I mean, that is something that they struggle with a lot. It's what we do with that information afterwards. We know who we are, right? And so I don't want us to get hung up on that, because it is something that I had to adapt, because I came in and that's what they were using. Not the government, I mean, literally community people were pushing for this category. But I just want you to have faith that as the data comes in, it's what we do with the data and how we present that data. We don't have to, we can say, according to the Office of Budget and Management or the Public Health Department, this is what's going on in the Ottawa community, or this is what's going on in various communities. So again, I'm just really eager to get that data and that information to be able to get the resources.
So we could just do all the three quickly together. Also, because right now when you go to fill out the census, you know, where it says white, under the white, it says also Middle East, North Africa. So it's already, you get what I'm saying? All we're saying is pull that out so that we don't have to get into the semantics. So it's already in there. We're just saying pull it out and make it separate.
The funding question.
RashidaforCongress.com.
Yes.
And the reason why, hold on, the reason why it's relevant to this conversation, and Rashida can't say this for herself, is that if we want representation and people who are going to fight for our people, we got to keep our people in there. Our opposition organizes votes and they organize money. And in order for us to keep voices like Rashida, like Ilhan, like others who are now advocating for the issues that we've been screaming about for decades in this country, we need this woman to stay in
And just a
Congress.
footnote, I am here on an official capacity as a congresswoman and not for.
Yeah, so that's why I can, so she's not allowed to say that I'm saying that.
Yeah.
Because we need the
Put it
congresswoman to
out
stay
there,
in an
but no,
official
yeah.
capacity of congresswoman, and you gotta help make it. This is a very interesting question about whether we can get data from the surveillance that this
I mean,
country.
my black community wants that data for their community as well.
So we do have some of that data through some FOIA requests, for example, from the New York Police Department, right? If you all remember back in 2013, we sued the NYPD over surveillance. And in fact, we got aggregated. Now I know where all the great kebab restaurants are in New York. I know the demographics of every Muslim-owned business in New York City. We know where all the mosques are. They literally, it was called the mapping program of the NYPD. They mapped our community, and I'm sure that happens in other states. So believe it or not, sadly, this makes sense. Even the special call-in registration program, when these Muslim men, most of whom were Muslim, went to register with the United States government,
Oh, the
NSEERS program, which only semi-shut down in 2011, but we were able to get data from that. How many men registered? How many men were on deportation proceedings? We were able to get some data. So sadly, when the government does it to us in the wrong way, we're able to get data from it. Imagine if we were doing it for good reasons and being able to get more important data about health and other kind of concepts, education, things like that. It'd be very helpful. But sadly enough, that's probably some of the only data that we have on our people.
Yeah, we do get a lot of data, immigration data, which is controlled by the Department of Homeland Security. But if you want to know where the Arab are coming from to the U.S., they know all of that.
All of
you
that.
can find all of that, yeah.
Let's do another three. We're going to go to the back. The kufiyya. And
Let her ask first.
who?
I know, it's so hard. It is so
Oh,
hard.
yeah. Okay, well, I'll let her ask her question, and then we'll go to the next person.
Hello, my name is Miriam. I'm Palestinian, as you can see. I have a question, so it's a little bit, I don't want to say it's a little bit off topic, but we are all either students or professionals of obviously Arab descent, and I wanted to talk about what can we do to protect the students and young professionals who speak up about Palestine, who get listed on Canary Mission so that they can get their voices oppressed. Thank you. I don't know if that's relevant, but that's a really important question for
It's a
me.
good question, thank you.
Well, come down. I know
We'll answer that next.
Soup the pink mask here, and you.
Yeah.
Yeah.
Yeah, they're doing that
Yeah,
now.
so yeah.
Hello, thank you for being here. Great panel. My name is Brahim. I work in community health education in the city. And my question is in regards to the developmental trauma and fractured identity and lack of self-actualization that has resulted from this systemic oppression through the census. There are a lot of studies that show that for MENA youth, that sense of fractured identity can precipitate poor mental health outcomes. So, we're talking a lot about the data and how, the implications of putting this box and getting that data. And yes, that's so important. But I think, I believe that we need to have a conversation about more of the long-term impacts of particularly among kids like myself who grew up here. So, how do we have those conversations as well alongside, talking about the funding and the data, talking about more of this, the trauma, which as we know among the MENA community is kind of hard to talk about.
Thank you. Just as a quick reminder, we want to be respectful of everyone's time, so
We have
yeah,
about
let's
5
limit-
minutes left, so we want to make
Right
sure
here,
we can
yeah.
get in as many people.
Thank you.
Hello, my name is Lena. I founded a community called Arab Socials, started in New York City and now growing around the States to connect Arabs around the States. The goal is to connect us, and many of us are young individuals, and a lot of us are people who came from abroad, such as myself. I'm a student here, and we don't have as much power. We are not citizens. So my question is, how can we help? How can we relate to the Arab American community and be able, without voting, but be able to also contribute and have some power?
That's good.
You want to do those? Do those three? You want to do those three?
Yeah, we have to do 3 at a time.
So I'm going to start with Sister in the back about the protection of students, because this is very important. Even though it doesn't seem relevant, it's absolutely relevant to this conversation, especially when we are at a university like Harvard. The bottom line is they can go after you, sister, but they can't go after all of us. And what that means is that not only do we need the litigation piece and the legal defense to protect our students and our student-run organizations to engage in constitutionally protected free speech, an organization, but we need courage. Because you cannot let these students, that's right, we can't let the students outside by themselves, and when they get into all this controversy that the right-wing Zionists and others start doing, and then everybody runs the other way because your parents told you came to medical school and we sent you here to do your studies. At some point, some of us are gonna have to decide that we gotta stand up for ourselves. But there are, of course, organizations like Palestine Legal, which did not exist like 8 years ago. So now we have actual attorneys, full-time attorneys who are representing student organizations and individuals across the country, also in employment. So that exists. PalestineLegal.com, go. You could do their form. They do take on these cases. They have won major cases across the country, and it's been incredible to watch that happen. Of course, some of you know that there are CARE chapters. There are other people willing to represent. I was actually represented here in Massachusetts after I was sued by students at UMass Amherst. Me and Mark Lamont Hill got sued, and then a Jewish attorney from JVP Western Mass chapter, she went to court for us. She just went and she said, I represent these people, and that case was destroyed in a matter of 5 seconds. So the point is, there are people ready to defend us, make that happen. I just want to say quickly to you, I think that the question you asked could be a whole panel in of itself, and I think it's an important question. But I will just say this to be clear here, that when there is a MENA category, inshallah, and that will happen, you don't even got to check it. This is not a forced thing, it's self-identification. So if there's someone, for example, that you really feel uncomfortable, or there's something about that really is not with you, guess what? Leave it alone. Go put other and go do whatever it is that you want to do, right? So the point I want to make sure that we're not saying here that we're bringing something to the community and shoving it down your throat and saying this is what you got to do. It's still, once again, something that is about self-identification. So there's still an empowerment piece for you, right? For you to decide what makes sense for you, what feels right to you. how do you self-identify? So some people might not want to identify as MENA. For us, we believe that it's a power-building project, right? We believe it's an opportunity to build political influence. We believe it's an opportunity for our business owners and our students and our aspiring students to get scholarships, to get access to opportunities, to get access to data and funding from the different agencies that we do not qualify for as Arabs, right? It's just not going to work if we don't do something. So, but again, it's still self-identification. And you bring up something very important. 2,000 comments, we need 50,000 maybe or 100,000. You don't have to be Arab American to provide a comment here because you're still a student and you still contribute to this society right now. You are still in this community, you are still in this area, you are still at this university. So being able to tell all your friends all across the country who are in Arab social, who are residing in the United States at this time, that they too can contribute as part of this. When we say Arab American community, I want to be clear that we mean an inclusive, because a lot of the people that our social service organizations are serving, in fact, many are who are impacted by these health disparities are in fact still immigrants, green card holders, some of them are undocumented. So we mean them too, because the census also counts people residing in the United States of America. They don't care just about United States citizens. So I want you to know that this idea of MENA is beyond Arab Americans, it's beyond American citizens.
So to go, and I just want you to know, there was a movement here, I don't know if you were here, of Dreamers. It's actually what got me into politics. We were doing an in-state tuition act for undocumented students, folks who were graduating from high school that didn't have immigration status, that wanted to go to higher ed. That DACA movement happened because undocumented immigrants, and I know you're not, but I mean, these are folks that couldn't vote, that obviously didn't have what we call this immigration status or documentation required, and they started a movement that resulted in passing a legal avenue to be able to have some sort of standing here in our country, okay? By the way, they're always going to be our neighbors. They don't need a piece of paper. That's what I truly believe. But we are working at, again, creating stability and getting them to a pathway to citizenship. So just know it can be very powerful, your voice, especially that you created this platform. That platform can really reach a lot of people. Miriam, I have to tell you, you are one of many that I talk to. This targeting of, I don't know if you know Matt, Dr. Anna Almery had the same issue from a professor long ago. She talks about it in her book. This has been going on campuses all around. The intimidation, the bullying, the targeting, to silence you, to vilify, to label, and of course this website, Canard, whatever they're called. I mean, this is incredibly important to say. One, you're not alone, and I hope as you move forward, you're not alone in that you push back. But know the processes on this campus. Know when those trustees meet, show up. Don't show up by yourself, but literally start speaking up, because I see this at University of Michigan, Ann Arbor, and people are starting to push up against it. I don't care what these organizations are. They're going to try to weaponize as much as possible what we're saying. All we're saying is Palestinians are human beings. They deserve to live.
That's right.
I think it's so critically important as I serve and been there for, even the first 6 months I was there. I haven't even told Linda this. I don't know, Matt, Linda. Like, I was asked what occupation means. I mean, again, this is not to laugh. These are really people that didn't run on this issue. They're there. I came with the largest incoming class, the most diverse class into Congress. There's all this, I want you to speak about the issue when you go to these trustees, you go to these meetings, you go to these platforms, talk to the provost, whatever you need to do, know that it's multiple strategies. It's not just having the speak among campuses, it's actually going with the people and making them answer your questions. Is this allowed on campus? I feel unsafe. What are you going to do about it? Because the fact of the matter is, everyone deserves to be safe on campus. To choose that you cannot feel safe fully because you believe in Palestinian liberation, to me is something, again, you got to push back against, because sis, everybody wants to silence me. But I know whoever comes after me, I've knocked at least a couple doors down and some movement, so that when he or she, a lot of she's please, but if she comes in, she can come in without, she can say apartheid, she can say Palestinians deserve to live, she can say all of these things without, so I say this to you because I'm not in your shoes, and I'm always so afraid for you all. I'm a mama bear. I am very protective, but please don't do this, move along alone though when you do this, please. I think it's so important that you know that there's so many behind you, because as you fight back, you're going to create that, hopefully, a safer space for the next young person that is on this campus. So I think it's really important. There was another question. Where was it? I forgot.
I think Linda got it.
I think
Linda
we got
got it.
all
Oh,
of them.
Linda got it. Okay, thank you.
We'll take a final 3 questions, just to be respectful of everyone's time and lunch. I know that Nadine has a good question over here, and then we'll make them really good questions. So who has
I feel like I
a
have to
really
pick-
good question?
I have to pick with my eyes closed for
I know.
fairness.
Okay, you and you. Okay, I'm sorry guys. I would want all of you to ask questions if I could.
Thank you all for coming. My name is Nadine. My mother is Syrian. Her ancestors are Syrian. My father is Palestinian Lebanese. His father and his mother and everyone is from the area. And yet, do I look white? So this is the question. And the question that comes after that is, what does white mean if I don't look white or if I don't fall under white?
Who's the next person? Right here. Thank you.
Hi, Hannah Khouri. I wanted to ask, when we're talking about the MENA region, a lot of the time it's used to identify Arabs. When we're talking about identity, how can we ensure that other people that are part of the Swana or MENA region, we're talking Afro-Arabs, Sudanese, Amazigh, Kurds, even Iranians, Turks, who don't have that same category like us, how can we make sure that they also feel included? They also feel that their voice is heard. They're also part of that data, that demographic. How can we make sure that we have that larger group and we're not just excluding it to Arabs? Because Arabs can kind of shut ourselves off to the rest. And I want to make sure that all of us feel included.
That's a great question.
Yeah, great question.
There is one question on the right. And that will be our last question. You're going to answer?
That's a good one.
Hi, thank you all for being here. I just wanted to ask quickly, I guess it could be more specific for Matthew, but there's a huge kind of stigma and a fear that exists in Arab households about the collection of data and privacy. What are ways to break that down in order to enhance that path?
Good question. Thank you.
Really good question. Thank you guys.
Perfect.
Do you want the first one?
You can answer
about
who.
the swan at the
Now, do you want to take the last question?
Last question.
I'll take the second one for a second. It is complicated, but like Kurds have been at the table in the MENA category. I mean, the census has went to all these groups and said, yeah, we don't just want Arab. We know that these, the nationalities are there. So Algerians are there. You can say you're Algerian and be part of the MENA category, whether you're Amazigh, whether you're Arab, like whatever it is. So yes, we want this to be as inclusive as possible because it's self-identity. It's how you identify. And if you see yourself as part of the MENA category, that's great. As far as like Sudan and Somalia, the federal government sees those communities as black, not as MENA. And they've done the research with those communities, and they ask those communities, if you see a MENA box, will you check it? And they say no, they're black. And that's but you can be black and MENA. They can be black and MENA. The great thing about what we're trying to do is make it so everybody can be whatever they want. You can check 3 boxes, right? You can be Asian, Latino, and MENA, and that's great. They'll count all of those. You will be counted in all of those categories. So we're trying to be as inclusive as possible, whether you're, whatever group. Even if your group isn't listed under the MENA box, if you see yourself as MENA, you can still be in there. There's no one's going to show up at your door and say, you know what, you checked MENA, but we don't think you're MENA. That's not how it works. Like it's about self-identity. Are you a part of the community? And we want everybody to have that feeling.
So I'm going to go to you and to the sister here. Yes, I agree with you that there's a lot of kind of stigma, but also misinformation and disinformation around collection of data. Overall, it's pretty anonymous. As you know, you can just, the way that which it's collected. I always tell the Arab, just fill it out before somebody shows up at your door. I mean, if that's what you're worried about, just do it when you're supposed to do it and nobody's going to come knocking at your door. But I think for us, knowing it's kind of like the pros and cons, right? You really got to weigh the pros and cons here. As I stated earlier, when the government wants information about you, it's going to get it, That's just the bottom line. Like we have, suspected terror watch lists that are over 2.5 million people. We have surveillance programs running across the country. We have no-fly lists. I mean, we could sit here for days and say that when the government wants you, the government's going to get you. And so there's more pros to us having a category, again, building political influence and power, as well as getting access to all the opportunities that we do not get access to, and being able to say to people that this is not the agency that they're going to use to target our people. And when they want to target our people, they know how to do that in other ways, which is why we have like the Department of Homeland Security, which was created for us. Let's be clear, it's only been around since 2003. So yeah, so we do, but the important thing that you're saying, it's part of the political education with our community. We have to have these conversations, and that's why it's important that US Census workers are also people from our community, that they speak our languages, that they look like us, that they're not sending us strangers to our homes or to our community census, to our mosques and churches, that they're sending our people. And alhamdulillah, over the years, even in the last 2020, there were hundreds of Arabic-speaking census workers and Muslim census workers and Afghans and all these different communities, because it helped to get people to feel like this was a safer process. I mean, your question was interesting. When I look at you, I don't see white. But again, the important thing about this is, yeah, and I don't see you as white, but again, it's about self-identification, because there could be another woman just like you with the same kind of story as you that says, I'm white. And that's the point of the census, that woman gets to say that she's white. Race in America is a construct. There is an agenda behind it. There's a reason why there's race. Because they could have just been like, what's the point of doing the aggregation? What was the point of having a white box, right? So I want people to understand that it's not something that's innocent. It's not just like, oh, fill out the little box here and just move on. There's something behind that. And what we're doing when we say we want a MENA box is we're challenging the dominant narrative, the one that says that the whites are the majority in this country, because they are not. Number two, that we are also not invisible people, right? And the fact that through the ways in which this box happens, let's say, for example, you put MENA, and then you also can put Palestinian, because we want them to also know that that MENA is so much more than just Middle East, North Africa, that there's so much more that is a part of it. Like, I want Amazighs to be able to say Amazigh, right? But also be MENA at the same time. Because there's a power in the collective unity and the power also in our diversity, right? And the government needs to understand that in a balanced way. So as Matt said earlier, they were trying to use our diversity against us, right? Oh, you all don't agree anyway, so why are you making us go through all this trouble? We want to say to them, listen, no, we do agree. And guess what? We're also going to teach you as part of this process. So when your workers are looking at all, because they have to look at the other, right? When they put other, that's not something that's just doesn't, you think it just goes nowhere. That's an important piece. When they see why the hell these people putting other, and get to see the diversity of the answers of other, that's also power for us as well. And it's also an opportunity to educate this quite uneducated country. Because I wonder if people even know who Amazighs are, and where they are, and what they are, and who they are. And so many other groups of people that are part of our kind of region, right? Assyrians and others, and so many other people that are, if we think we're invisible, imagine those other minority of Druze and others that are part of our community as well. So there's so much power in this process that I can't imagine, what we lose about being able to say we are one, but we are one of many people.
I'm so sorry to anyone else that had questions. We are way over time. I got like a end like 10 minutes ago, so I'm running by very late Arab Standard Time. And it's your lunch hour, so thank you to everyone that came. I mean, really, thank you to our speakers. Thank you for an amazing panel. To my partner, Safa, to the organizers, thank you again. Thank you.
Of course. So what I'm going to do in like 10 minutes, is I'm going to